So let me move on now. We'll move on to taking a minute or so, 10 to be exact, to talk about the psychosocial aspects of cancer survivorship. And I'm pleased that we have Dr. Kathleen Neville with us, who is a professor of nursing at King University and very dedicated to this whole domain of understanding and intervention. Dr. Neville.
Thank you. I'm delighted to be here, and I will try to communicate what I need to say in 10 minutes. But actually, it fits very well with what Donna said and what Regina said. What I'm really trying to speak about in 10 short minutes are really the psychosocial needs of individuals with cancer and their patients. And I think if I had a encompass what both Donna and Regina said, it really deals with self-advocacy skills, which Donna obviously possesses, and knowledge, really having the knowledge about your illness and what to expect, what's expected and what's not expected, so that you can ameliorate as many psychosocial concerns as possible. As a professor, I tend to look towards the literature in gaining knowledge. And what I obtained was one of the newest reports from the Institute of Medicine. It's online. It's the Cancer Care for the Whole Patient Meeting the Psychosocial Health Needs, a 2008 report. And it really was a very moving document that really speaks to addressing the psychosocial needs of Americans with cancer and how across the board, across the country, we really do need improvement. There are segments of facilities that are doing this very, very well, but overall there's a need for general improvement. So this Cancer Care for the Whole Patient report really speaks to the need to comprehensively address psychosocial concerns of individuals. But what I really liked most about this report is it really addressed the family members, and that so often family members are excluded from receiving psychosocial care, and they are the people who are very, very much burdened. It is expected that caregivers often suffer adverse psychological states similar to their loved one, and that their mental status can directly affect the ill individual's health state. And so what that does, it creates a circuitous situation, and there's actually a bi-directional effect of depression or anxiety that occurs among family members. So what this call to action really does is speak to the need not to only include the individual faced with cancer, but also include the family members, significant others, and loved ones as well. While we know that the cancer incidence is rising, I was a little startled when I read in this report that it's now estimated that 41% of Americans will develop cancer in their lifetime. I remember years ago it had been 1/3. So the numbers are definitely rising. The fortunate thing is that survivorship is really quite dramatically improved. Cancer today provides highly advanced state-of-the-art biomedical treatments for over 100 types of cancer, whereas in previous years, cancer was considered one disease with ultimately and uniformly a fatal outcome. We know that's quite different now. Where both for men and women, survival rates are at 64% and climbing. But as Regina spoke, the advances carry burdens, as many treatments are very aggressive and physically challenging for varying lengths of times. Increasingly, as time progresses, sequela of treatment interferes with bodily functions and can cause renal, cardiac, pulmonary, and neurological impairments. This necessitates constant routine and episodic follow-up with healthcare providers. And at times, survivors, it may seem to them and their caregivers that they're never out of the healthcare system, whether it be for continuous monitoring or treatment for exacerbations of health problems, because cancer is a chronic illness. Given the numerous life-altering changes that may occur with the diagnosis of cancer, including the physical, emotional, social, and financial changes experienced, there are many psychosocial problems that people routinely experience, and this can be anxiety, depression. We know now that people develop experience post-traumatic stress disorder. There's emotional and psychological distress, fear, and uncertainty and illness abound in the literature. It is important to note that the majority of individuals with cancer and their families have normal psychological functioning, but emotional or psychological distress is not uncommon. Currently it's estimated that about 1/3 of cancer survivors experience high enough rates of psychological symptoms to meet clinical criteria of anxiety, depression, and adjustment problems, as well as PTSD. Experiencing these psychological problems, as many of you know, and anyone experiencing family members or themselves with cancer, place individuals in less than optimal situations by significantly reducing quality of life, and they can interfere with treatment. Depressed or anxious patients often report more somatic complaints. They have more sleep disturbances, fatigue, and pain, as well as they can engage in more negative behaviors, health patterns such as overeating, smoking, and sedentary behaviors. In addition, depression and other negative psychological states interfere with positive behavioral changes and adherence to treatment protocols, as they can create cognitive impairments, decrease one's ability to cope, and weakens one's motivation to improve health states. Increasing evidence shows that psychosocial stressors can physically affect the body, altering the neuroendocrine, immune, and other bodily systems. Survivors report, my area of expertise is in uncertainty and illness, how not knowing really drives you nuts, and if you had the right information, that could dissipate a lot of your fears and concerns. Survivors report uncertainty as not knowing what will happen in the near and far future, or when to be concerned about bodily changes, or how to discern normal changes of ages from signs of disease, recurrence, or progression. While uncertainty in illness has been identified, it is the most pervasive psychosocial issue in cancer throughout the cancer trajectory. Research has identified that trigger uncertainty is an especially problematic area among survivors. Specific triggers such as checkups, media events, learning of disease progression among survivors, and new bodily changes and late emerging effects are related to substantial emotional distress. All of these completely understandable and significant problems complicate an already difficult situation by further interfering with our work, family, and other social roles, as well as predisposing individuals towards adverse negative health outcomes. In addition, feelings of loss of control, isolation, stigma, vulnerability, guilt, role changes, and feeling different from others are common experiences in cancer survivorship. This cancer care document reported that across the country, cancer care is often incomplete, and that many people report that their cancer care needs are not being met. Most significantly, patients reported in this document, they reported dissatisfaction with the amount and type of information they're given about their diagnosis, prognosis, available treatments, and ways to manage their illness and health. Furthermore, this information, they said, was not communicated in ways that are understandable to enable action by patients and family members. Also in this report, individuals reported that their care providers do not understand their psychosocial needs, do not consider psychosocial support an integral part of their care, are unaware of psychosocial health resources, and do not make referrals for psychosocial stressors when evidenced. When I read this report, I found it quite startling. In this report, patients identified a number of problems that affected their health, and one of the problems was poor communication. And if I have a minute, I think effective communication is the most important thing that you can advocate and do for yourself. The other element that patients reported in this report was lack of knowledge, and even though it was a psychosocial report, they included lack of transportation, financial problems, and lack of health insurance as their major problems. So the IOM, this committee did develop a proposal for improving psychosocial care, and they developed 10 recommendations. But what I got out of this, reading this report, is that the key to improvement of meeting psychosocial needs is really effective communication. Effective communication between patients, caregivers, and family members is essential in accurate assessment of informational needs and preferences in designing care. This is a difficult concept, though. Information determining, as a nurse, determining patients' preferences has cultural ramifications, age ramifications, ethnic ramifications, and very often it's very difficult. Denial kicks in. Very often it takes an exorbitant amount of time to ascertain what information they really need to know. While the onus of responsibility, I believe, lies with the health professional to perform an assessment to determine what communication needs or what information needs people have, I now shift that thought, and I believe that individuals with cancer have a responsibility to communicate their needs. By communicating their needs, really their information, their fears, their worries at night, staying up at night at 5 o'clock in the morning, worrying about what's going to happen to them, trying to distinguish between a late treatment effect versus a progression of disease is really important to improving their psychosocial support. So I know I'm probably at 10 minutes, am I?
No, you're doing okay.
Oh, good.
You have a couple.
Okay. Basically, I really think that the most important thing to help people survive and achieve and improve after a life-altering experience of cancer is really to self-advocate for themselves and to seek the information you need. Because it's my belief that there are so many unnecessary fears that can be just dissolved by communicating with your health professional.
Thank you.
Thank you.